and Dr. McDonald-Mosey wrote an op-ed in the New York Times last week criticizing this move by Donald Trump. So first of all, tell us, what was the regulation and what did Donald Trump roll back?
So with the passage of the Affordable Care Act, there was a provision that required for all preventive services that were established by the Institute of Medicine to be covered without cost to the patient, to the user. And that included all of the FDA-approved methods for birth control. So that meant that before the Affordable Care Act, someone might have to come out of pocket for $20, $50 a month for birth control pills or the patch or the ring, for example. Or they may even have to come out of pocket for up to $1,000 to get one of the more expensive methods like an intrauterine device or a contraceptive implant, the longer-term methods of birth control. But after the passage of the ACA, the vast majority of people wouldn't have to pay at all, and they could make the choices about what birth control method they wanted based on their medical history and the other preferences that were important to them and their lifestyle, but not based on cost.
And the argument against that is that birth control or contraception is just has nothing to do with health care?
I mean, birth control is not controversial. It is an essential part of healthcare. In fact, in the last century, it's probably one of the most important advancements that's been made in healthcare in terms of the development of birth control methods and dissemination of them. It's widely utilized. 9 out of 10 women during their reproductive life years will use birth control at some point.
Including 95% of Catholic women, may I point out.
Right. It's
despite the position of the medieval Catholic Church.
That's exactly right. Women of all, makes and religions use birth control. It's safe, it's effective, it's hugely important. Healthcare is an essential human right, including the decision to decide whether and when to have children. And so what the Trump administration did here is really take aim at this provision to say that employers can decide whether they want to cover birth control at all for any reason.
Well, particularly for religious reasons,
right,
correct?
Or for moral reasons.
You know what I find so interesting about this is we're still living in an age where so many birth control decisions are made by people who just don't understand it. I'm reminded of when, you remember a couple of years ago, Rush Limbaugh got in a lot of trouble for a fight he had with Sandra Fluke because she was trying to get health contraception.
Yeah.
And he said, like, she wants to go and get as many pills as she can. And his sort of argument was, like, he thinks that you take a pill, like, every time that you have sex because that's how, like, a pill works for a way. Like, it just, like, totally doesn't understand the whole process of it. And, like, he ain't alone in that.
Right. And I think that's what's particularly frustrating about this is that the Institute of Medicine, they're a group of experts, women's health experts. They spent, a year and a half looking at all the evidence around this, having testimony from other experts, deliberating, and made a decision about these are the things that there's a lot of evidence to suggest that we should cover these things. And birth control was on the list.
Right.
And now with just a swipe of the pen, that's all taken away, despite all of this evidence.
So what I don't understand, if this were part of the ACA, which is the law of the land, how could the president change, with a stroke of the pen, the law of the land?
Well, I have to admit, I'm a physician and not a politician or a legislator, so I'm not sure how that's the case, but it seems completely unreasonable to me. But it's completely in line with the attack that the administration has been making on women's health care broadly from the day that Donald Trump took office. I think in his first days, he already re-implemented the global gag rule, which directly takes aim at access to family planning abroad, and this is just a full extension of that here.
I think I can answer my own question, actually, because once the law is passed, then it's up to the departments and the agencies to adopt the rules and regulations that carry out that law. That's the executive branch's job, and I'm sure he made a change in the way the executive branch, HHS, was implementing this particular policy that was part of the ACA. But what is the impact on American women? The Trump, according to the New York Times yesterday, the Trump administration says, with no evidence whatsoever, the New York Times points out, that these new rules will have no effect on 99.9% of the 165 million women in the United States.
But there's no way that they can say that. There's no study to have demonstrated the effect of this. There's no analysis that's gone into this. And I can tell you as a healthcare provider.
What do you say the impact will be on women?
I think it will be significant because with the passage of the Affordable Care Act, when a person came to the health center, again, they could be counseled about all options and choose whichever one that they wanted. And we as healthcare providers could know that whatever they chose would be covered. But now we'd have to go back to the bad old days where you have to actually check to see if the person has coverage for birth control. And especially if she's choosing one of the more expensive methods, it's very important to check to make sure that she's covered for that so that she's not going to be sent a bill for an exorbitant amount of money that she can't afford, right? And so logistically, in terms of what's going to happen in implementation of this, it's going to be a huge burden for women and for providers.
What I don't get also is, so who is for this change? I mean, who's Donald Trump answering to by making this change?
Well, you mentioned HHS. I mean, it's true that he has appointed people to Health and Human Services who don't believe in birth control, don't believe it's effective, don't believe in comprehensive sex education. But there are other appointees there, and so
I don't think that I think there are a lot of people there who are following Tom Price's lead. I don't think that he was alone in his feeling.
Right,
Yeah.
and there are other appointees there who have.
But he didn't do it for the federal employees. I mean, this is the
It's pandering to his base.
to his base,
Right.
Particularly the evangelicals, right?
But it's still.
Don't you think women? I mean, men. I mean, in his base, there are people who practice birth control.
Absolutely. Again, 9 out of 10 women at some point
right.
will use birth control.
It's
and the reality
insane.
is that a vast majority, over 80% of Americans, actually support policies that make birth control more accessible. So this doesn't make sense. None of it makes sense.
The thing that really, really bothers me about this is the idea that this is done in the name of religion, that it's done in the name of faith. I mean, okay, you're a doctor, you're not a politician, you're not a preacher either. But, you know, I like to say, where the hell in the Bible are you getting this from, right?
Right. Where does it make sense to make it harder for people to decide when and whether to have children? Where does it make sense to sort of make health disparities in this country, to exacerbate them by making it harder for low-income patients to get care? Where does it make sense for an employer to be able to make these very personal decisions for people? This has no basis in religion or morality. It's completely insane, and it certainly, it rebuffs every piece of evidence and everything to do with good public health practices.
And these guys, and I say guys because they're the ones
For the most part,
they are. For the most part, the ones making these decisions. Like, there's a time to sort of lead and take, just sort of like push forward with something. And then there's a time to like just shut up and listen. Just shut up and listen. You really might learn something. I don't mean just like listen to your and when I say shut up and listen, I mean shut up and listen to the women around you, and not necessarily their wives, because like they get great health care, as do our elected officials, which a lot of people don't get. But like every single one of these politicians has someone in their constituency who has a problem with this. Like it's a real problem, and just like listen to those voices.
Right.
Also, just to show how really evil this move is on the part of Donald Trump. Not only did he say he's going to change this policy, but the normal period where they put out a change in policy for public comment, which is 30 days or 60 days, whatever it is, they're not doing that this time because they claim that they have to do this so quickly. If they went through the normal process of seeking public comment, that would be, from the Donald Trump memo or order. The normal process of seeking public comment would be impractical, unnecessary, and contrary to the public interest. So they're rushing it through, saying it's in the public interest not to have the public comment on this change.
Yeah, they're probably afraid that they would get a lot of negative comments. I mean, there was a show at the March for Women's Lives of power and strength and fortitude of women, and that is very real, and that's a very real movement in our country, and they're afraid of that in their backlash of the comments. And so they're just pushing this through and pushing this down the throats of the American population, and people will suffer. You mentioned that, the nature of our insurance program, most people get insurance from their employers. And most of our legislatures and people making these decisions, they're not going to be affected because they're going to be able to either have the means to ensure that their wives, daughters, whomever, get the care that they need, but many of their constituents will be. They will be affected. And there will be a trickle-down effect from there in terms of public health outcomes.
Right. So